Session today is around what joined up primary care data shows. Today's presenters, so it's myself, Matt Sweeney, so I'm Director of Marketing, Product and Operations, Redmore Health, and I'm joined by my colleague Claire, who's Digital and Transformation Programme Lead. So before we get started, just a bit of housekeeping. So we are recording the session today, and so what we've done is we've taken your videos and microphones off while we go through the presentation. But if you've got any questions throughout, please use the chat function, and what we'll do is we'll sort of keep tabs to the questions and we'll go through them at the end. After the end of the session as well, we'll take off the mute, so you can sort of open up and ask any questions yourself and come off video. What we'll be doing is we'll be sharing the recording after the session alongside the slides, and we'll be putting that on the D&T Network forum as well. So if you haven't registered for this session directly, so if you joined via a link that was shared by someone else, please can you make sure that you put your email address, job title, and organisation name in this chat. That way we can make sure you're invited to the D&T Network so that you've got access to the recording and things after the session. So this session is brought to you as part of our D&T network. So it's a free community for anyone that's interested in digital transformation across primary care. It includes these monthly webinars that we run. It also includes an online forum where you can sort of share information, access resources and things like that. It also includes a monthly newsletter. All of it is free, and yeah, it's intended to share knowledge and information. We've got over 1,300 members across primary care, and if you want to join and you haven't joined already, please use that QR code. We'll also send an invite after the session as well. Okay, so agenda for today then. So first of all, we're going to set the scene. So we're going to look at the challenges that we're trying to solve in primary care and why joined up data really matters from that perspective. And we're going to be using our Edge platform. So this is a new data analytics platform that we built in-house. We'll explain how it's developed from our previous iteration with the Digital Maturity Index, and how we try to build it in a way that's practical and operational for developing primary care insights and supporting projects with evidence. We're going to go through what's included in Edge. So we're going to walk through the key areas that Edge covers, how practice are using it day to day. We're then going to look at what the data shows. So we're going to look at real examples, what's changed around online consultations, NHS App, and patient experience over the last year or so. How it can be used at PCN and ICB level. So to do things like spot variation, target support, and track improvements over time. And then we're going to look at support available. So we're going to outline sort of our improvement offers, which will give you access to Edge alongside other services that we offer. And then finally, we'll open up to Q&A. So like I mentioned earlier, put any questions throughout the session into the chat, and then we'll address them all at the end. So brilliant. Thanks very much. I'll pass over to Claire that will talk from here.
Thank you very much, Matt. So yeah, we wanted to first of all set the scene. So obviously in primary care, data has always been available, but rarely joined up. Information about access, patient experience, digital usage and population health often sit in several different places, making it difficult to see what's really changing or where improvement efforts should focus. And in terms of digital, 2025 was rather evolutionary rather than revolutionary. The focus mainly still remained on access and on making those access routes work properly for patients, particularly with online consultations, telephony and practice websites. Obviously from October, online consultation routes were required to be available throughout core hours, shifting the emphasis from whether digital access exists to how well it performs in practice. And at the same time, the NHS App use has continued to grow with significant variation between practices and areas, and AI has become part of day-to-day workflows, changing how work is done. So together, these changes increase the need to look at data in the round, over time and at different levels, to understand that variation, to track the impact and to target improvement more effectively. And what are we trying to solve? So practices, PCNs and ICBs are asked to work with more data than ever, but that data is often, like I said, spread across multiple systems, reports and dashboards. And this makes it really time consuming to access, difficult to interpret and hard to use consistently for improvement. So Edge brings that information together in one place. To save time, it'll reduce the need to log into those multiple systems or try and pull together multiple spreadsheets. And it provides a single trusted view of key practice and system level data. It makes opportunities easier to spot. You can see patterns and variations across practices, PCNs and ICBs, and you can highlight where improvement support or sharing of good practice might be most useful. And it supports meaningful improvement. So helping practices track that progress over time for projects that might already be underway. But then it also makes it easier to understand whether those changes are having the intended impact that you wanted them to. It also helps you to enable more informed conversations. So to support clearer discussions between practices, PCNs and ICBs using shared evidence. It reduces the reliance on that anecdotal evidence by grounding decisions in the consistent data that you can see. And again, it reduces duplication and the reporting burden. So reduces the existing national and operational data rather than also asking practices for more returns. So it creates a common baseline that can support multiple programs and priorities. So it might be useful for you to understand how Edge came to life. So in late 2021, we were asked by a local area to understand how digitally mature their practices were. And at the time, the quickest way to do this was to build a simple spreadsheet using data that we could easily access. So things like GP website information, POMI data, EPS and ERD. And as more data became available, we kept adding to it. And what started off as a one-off exercise gradually filtered out into other areas and became our digital maturity index. Now, by 2023, it was clear that this approach had its limits. The spreadsheet was becoming harder to maintain, and it wasn't easy for practices to see patterns, trends, or opportunities. So we moved the data into a visual dashboard, automating the feeds where possible and making the information far more accessible, both for practices and for us. And then over time, the data itself also changed. So POMI was withdrawn. And while new and increasingly important data sets were added, so things like NHS App, telephony, and other operational measures, at that point, the tool was no longer just about digital maturity. It had become a much broader view of how practice is performing and where progress is being made over time. So that's why we've rebranded it as Edge, your evidence and data dashboard, reflecting what it really is now, a single place to understand your starting point, to track change and identify practical opportunities for improvement. So what's included in Edge? We currently have online consultations, which includes supplier information, submission types and activity over time. We've got NHS App information, including those registrations, logins, and again, activity over time for you to look at. We've got the GP survey questions and the trends that come from previous year's GP surveys. We've got a little bit of income in there. So we've got some QOF and some learning disability health check information for IIF. We've got friends and family tests, whether they've been submitted and the results from those surveys. We've got digital inclusion. So we've got in there IMD scores per practice and population areas and main spoken languages. We have got also some population health data in there. So it's from fingertips and we picked out all of the health related data and popped it in there for you. We've got the information on telephony that came out late last year. So that includes calls received, missed and callbacks. And we've got the GP registration service. So we've got how many registrations have been received in the practice and how many were completed through that GP reg service. Now, we've been working with an example practice since August 2024, so supporting them across a range of digital access and operational topics. So this included monthly support calls focused on practical advice and agreed actions, access to webinars, shared learning and peer insight, and ongoing use of the D&T Hub and Edge to understand and track their performance. So rather than walking you through each section on Edge, we're going to use this example to show how insight can be applied in practice and how data can be used to track progress, evidence improvement, and support that decision making over time. So we started by looking at online consultations and which appointments were easiest and safest for patients to book online, focusing on areas like routine GP appointments and cervical screening, where demand is predictable and criteria are clear. The practice then refreshed the wording used across their website and social media, making it clearer to patients which appointments could be booked online, what the online route should be used for, and what could still be managed differently. So alongside this, the internal processes were adjusted, so the team were confident handling those online requests consistently. And over time, they gradually increased the number and the range of appointments available online, using the data to test what worked, monitor inappropriate bookings, and making adjustments where they needed to. So this phased approach allowed the practice to build confidence without increasing risk or workload. And as a result, online consultations have become a core and sustainable part of their access model, with inappropriate bookings kept to a minimum and demand handled more effectively. There are still some appointments that remain more complex, such as certain clinics that require pre-assessment and some nurse-led appointments, but these are being worked through iteratively rather than forced. So the focus has been on progress, not perfection, and on ensuring online access supports both patients and the staff. And this slide shows just how the changes made to the online consultations affected when patients chose to contact the practice, not just how many contacts are coming in. So in January 2025, most online consultation requests were heavily concentrated in the early morning, particularly around the 8 to 10 a.m. window. And this mirrored the national rush hour seen with phone calls and created pressure on both clinical and admin teams at the start of the day. But following the changes to the appointment availability and the online consultations, having that clear patient messaging and the increased confidence in using the online routes, we can see a different pattern by September 2025. So while the overall volume of online consultations has increased, the demand is now spread more evenly across the day, with patients submitting requests later in the morning and into the afternoon rather than all at once. And this shift is really important. It reduces that early morning spike in demand, and it creates more manageable workflows for staff. It also makes it easier to triage and respond to requests safely, and supports more predictable use of clinical and admin time. So the key point here is that improving online consultations isn't just about increasing uptake. When they're configured and communicated well, they can help to smooth demand, reduce the pressure at peak times, and support a more sustainable access model for the practice, as you can see there. So the practice also made a sustained effort to increase both registration and meaningful use of the NHS App, rather than treating it as a one-off promotion. So this included running in-practice and community events with an NHS App stand to support patients face-to-face, and using social media and practice communications, explaining what the NHS App can be used for, how to set it up properly, including switching on of notifications, and how it can replace phone calls and paper processes. The focus wasn't just on downloads, but on helping patients understand how the app fits into day-to-day contact with the practice. And as a result, the NHS App activity is now supporting more self-service actions, such as those repeat medications, people viewing their records, and the appointment management. And it reduced the reliance on inbound calls for routine tasks. It's also better use and lower cost digital channel, helping practices to manage workload and their SMS costs more effectively. So we can compare the practice's NHS App usage with the national average on the Edge tool, allowing us to look at both registration and the meaningful use over time. So on the left, you can see that the full NHS App registration is increasing steadily, broadly in line with the national trends. So this tells us that local efforts are keeping up pace with the wider system rather than falling behind, which is important given that the national push on NHS App adoption. But the more significant change is shown on the right-hand side. So the NHS App logins are consistently higher than the national average and are rising at a faster rate. And this indicates that patients aren't just registering, they're actively using the app to manage their care. So this means that patients from that practice are more confident using the app for routine actions. More activity is being shifted away from the phone and face-to-face contacts. The combination of that steady registration growth and the faster growth in logins just shows that the focus on education, messaging, and support has translated into real behavioural change, not just headline uptake. So this also helps the practice to identify the next opportunity for improvement, which is going to be for them increasing the proportion of fully registered users, which would unlock even more functionality and further reduce that avoidable practice workload. So this is the friends and family test. And as you can see, it's the responses over time. And they give us a sense of how patient experience changed alongside the access improvements. What's important here is that the number of response increases, giving a more reliable picture, while the majority of feedback also remains good or very good and grows steadily over time. And at the same rate, you can see those negative responses stay low, even if the access routes and the ways of contacting the practice have changed. So this suggests that the improvements made to access and digital routes were delivered without harming patient experience, and in this case, appear to support it. And now I'm going to share the GP survey data with you on how practices use those online services and how easy they find the NHS app. So if we look at how easy they found the online services, over time, fewer patients report using none of these, and more say they're using things like repeat prescriptions, appointment booking, and accessing records. And we also want to see a shift away from patients finding the NHS app difficult towards more reporting it as fairly easy or very easy to use, even though some still haven't even tried it. But taken together, this suggests that the digital services are being used more widely and with growing confidence, reflecting the impact of the access and the NHS app improvements that we've been working on. Again, the GP survey results, but looking differently this time. So the survey questions on contacting the practice by website and phone, alongside patients' overall experience. So starting with the website, we can see that while a proportion of patients still say they haven't tried it, there's a clear shift towards finding it easier to use over time. So those improvements are still working. Looking at the phone experience, there's still pressure, but we can see movement away from the very difficult, with more patients reporting it as fairly easy. So that aligns with what we'd expect as some of the demand is successfully redirected to other access routes. And then finally, we'll look at the overall experience in the practice, and the picture of this is very reassuring. Most patients continue to rate their experience as good or very good, and this remains stable as the access routes have changed. So this shows that change to access routes can improve usability without negatively affecting overall patient experience, which is a key concern for practices when they're going through some of these changes. Now, having strengthened their online consultations and NHS app use, the practice's next focus is telephony. with the introduction of an automated care navigation service to help again reduce the pressure on the call queues. So from October 2025, it gives us the best first full telephony baseline data in Edge. And this allows the practice to track how calls are handled today and measure the impact over time. So particularly whether more calls are resolved during the IVR stage, which is the invoice recognition stage. And this is where they've got the new care navigation system put in. So what we'd like to see is an increase in the calls resolved in the IVR stage. So looking back on the progress that the practice has made, they've improved and embedded online consultations. They've spread demand more evenly across the day. They've increased NHS App uptake and meaningful use of it. And they've also maintained that positive patient experience. And the key theme throughout this has been iterative improvement. So using that joined up data to make changes safely, test what works, and evidence impact rather than relying on assumptions. So we're going to look at it from a PCN point of view now. And as we mentioned earlier, Edge is even more powerful when it's used to look across practices rather than looking at them in isolation. So by bringing together this data, PCNs can develop a much clearer picture of where support is needed and where the change will have the biggest impact. At a PCN level, Edge helps to identify that variation between practices, for example, in call volumes, online consultation use, or NHS App uptake. And this makes it easier to distinguish between issues that are genuinely practice specific or issues that point to a PCN-wide opportunity for improvement. Using these insights, PCNs can plan standardized PCN-wide approaches, and rather than asking each practice to solve the same problems independently, you could do things like agreeing consistent front door models and messages, and then standardizing how online consultations are configured and used, or aligning appointment types, workflows, and the use of VARS roles. But importantly, Edge allows PCNs to move from reactive problem solving to proactive planning. And instead of responding to complaints, pressure points, or assurance requests in isolation, PCNs can use shared data to prioritize where it's most needed, track whether agreed changes are working, and then demonstrate improvement using evidence. So this example shows how bringing together telephony, online consultation, NHS App, and patient experience data helps PCNs understand how patients are accessing services and how that can change over time. So this is just a snapshot of PCN from October 2025. And in October, that PCN saw 30,000 inbound phone calls, just over 6,000 online consultations, and 1,600 interactions via the NHS App. So looking at these routes together gives a much clearer picture than reviewing any one channel in isolation. And it allows practices and PCNs to see where demand is going, how balanced the front door really is, and whether alternative access routes are being used as intended. And this view becomes even more powerful when you combine them with the GP survey questions, including how easy is it to find to contact the practice by the phone, how easy is it to contact the practice using the NHS App, or which of the online services have you used in the last 12 months. But by layering the patient feedback over activity data, PCNs can start to understand not just what's happening, but also how it feels for patients. And this is a good example of where standardized processes can be introduced, and you can track those changes. So what we'd expect to see from effective change over time would be a gradual shift of some of the demand away from the telephone towards those online consultations and NHS App where appropriate. We'd want to see improved patient experience scores alongside that shift, not just instead of them. And you'd want to see those call and contact heat maps that show demand, again, spreading more evenly across the day rather than at that peak time in the morning. So the aim is to create a more balanced and resilient front door where patients are supported to use the right route first time and practices can manage demand more safely and predictably. And our digital inclusion data helps practices, PCNs, and systems understand who their patients are and how they're most likely to engage. So rather than a single approach for everyone, it allows communications to be shaped around a local population need. So in this example, the average level of deprivation across the PCN is relatively low. And in areas like this, clear digital messages with a strong call to action, such as links to online consultations or booking pages or the NHS app, are more likely to be effective for a larger proportion of the patients. And they can help reduce unnecessary follow-up contact when supported by the appropriate alternatives. But the data also shows that around 84% of patients have English as their main spoken language, but there are clear concentrations of Punjabi and Urdu speakers. And this insight can be used when planning campaigns at a PCN level, providing key messages in those alternative languages, providing translated content for high impact communications, and being more deliberate about where simple language or visual formats are needed. So viewed along the other data, such as the NHS App usage, this information can help teams to target those communications more accurately and avoid widening those digital inequalities, and hopefully to improve response rates without increasing the workload, and also make better use of existing digital access routes. And the aim of this isn't really to create more messaging, but to make existing communications more relevant, more inclusive, and more likely to work the first time. And the newest addition to Edge is the GP Reg data, which gives PCNs a clear view of how patients' registrations are happening across practices, not just whether a digital registration is switched on. So at a PCN level, it shows the total registration activity across all practices, and it also shows how many registrations are submitted and accepted via GP Reg. And the overall digital uptake of registrations is up there alongside those non-digital routes. But looking at this collectively helps PCNs move beyond the individual practice performance and understand how consistent the registration journey really is for patients across the network. And then variation in GP Reg uptake often isn't about patient willingness to register digitally, but about differences in internal processes. So for example, how registrations are reviewed, how the exceptions are handled, or how quickly requests are actioned. And then the GP Reg data makes those differences visible, and it creates a strong opportunity for PCN-wide process improvement to align how registrations are processed and accepted, reducing that unnecessary manual handling or duplication, and making better use of the digital registration forms and reducing that admin pressure. And as we discussed on our recent webinar, digital pathways like GP Reg only deliver those benefits when that internal practice process is aligned to support them. And when that happens, practices can release admin time, and they can improve the consistency for patients and reduce the avoidable follow-ups. So the focus isn't on forcing digital for everyone, but on making sure that digital routes work well where they're appropriate. And practices aren't creating extra work by running inconsistent processes in parallel. I'm going to pass over to Matt now.
Thanks very much, Claire. Great. So we've also built Edge so that it's useful at an ICB and a regional level as well. So particularly for ICBs within their new remit, trying to identify and sort of reduce the amount of variation across their patch is going to be a really important priority. So Edge can be really useful for that. So we try to build it across all those data sets that Claire's done, alongside enabling you to look at practice level data. You can also look at sort of how the spread across ICB works too, and also at regional level. And this can be used to like identify practices that maybe need some support with specific project support. So that's typically how we'll work in ICB programs. It's a useful tool to say, okay, we'll go in and we'll work on a focused project with this PCN or this practice. around NHS App uptake, online consultation uptake, and things like that. It also can be really useful for sort of tracking evidence to see whether any interventions that the ICB do are actually helping to reduce that variation or provide improvements at a digital level. And it can also be used to actually benchmark how a region or an ICB is doing against other ICBs across the country. So I'll show you a few sort of screenshots to sort of bring it to life a bit. So within the NHS app, so this table here, I've used Cambridge and Peterborough ICB as an example. And this is showing the registration rates across all the PCNs in the area. You can also split this by practice. And what this is showing is per registration rates per 1,000 patients. So it's normalizing for the fact that different practices are going to have different capitation rates. So you can see there's a lot of variation within Cambridge. I think this is quite synonymous with how it works across all the ICBs across the region. So you can really see we're working with those PCNs and practices that got low registration rates, and doing focused work there can help bring them up to those areas that are seeing it doing well. Similarly, with online consultation adoption, there's a few different data sets that you can look at this across ICB region. You can look at it in terms of the rate per 1,000 patients of OCs that have been submitted. You can also see the split between the clinical submissions and the admin submissions too. And again, this is available to filter based on both PCN and practice view. Similarly on QOF, so you can see the QOF overall rankings for all the practices within an ICB in the previous QOF year. And alongside sort of the overall sort of QOF performance, you can also drill down into different domains and different groups as well, and see how different practices are ranking up. It's also useful, like I mentioned, to see across all the ICBs in the country how an ICB is performing. And you can do that across all the different data sets. So this screenshot in particular here, this is showing health check completion rates by ICB. So we've recently worked with some areas to really focus on improving health check uptake through communication and project support. So in terms of identifying sort of hotspots of areas where they can improve, I think this is a really useful graphic. We've sort of split it between the top performers that are in green and the bottom performers in red and amber, sort of a traffic light system. So yeah, so in terms of NHS App rates as well, so I showed you earlier sort of the split within PCNs in an ICB. This is looking at across all the ICBs, who are the top performing ICBs to the bottom. So there's a bit more standardization here versus the actual variation you see within practice and PCNs, but there's still some ICBs. So you can see here, Surrey Heartlands is it's got the highest rates of NHS App uptake by registration rates. So so that's sort of a conclusion of our overview of Edge. So Edge is included within our practice digital improvement service. So if you're a practice or a PCN, what we try to do is create a low value service. It's £99 a month. And within that, you get a digital transformation hub, which includes lots of toolkits and project improvement support around anything digital transformation. So there's 36 different topics within it. It also includes Edge, and you will also get access to a named digital lead from our team who can be on support for you to support you with webinars, to support you with CAP submission templates, with governance support for an hour a month. So it's provided a sort of light touch support basically for when the new GP contract comes in, when the DES contract comes in, it's got those new digital requirements. We can help you be the team that provides that ongoing support through software and services. And we've got an offer on at the moment where anyone that signs up in the next week or so can get a £75 discount on Oberoi tool, which is like a QOF tool. Highly recommend it. It works really well with our wider services and toolkits. So if you want more information, contact us after this session.